What if I told you that most Americans don't have a healthcare cost problem? They have an insurance strategy problem. Because right now, millions of people are paying hundreds, sometimes thousands of dollars more every year for health insurance. Even though they use the same doctors, get the same prescriptions, and receive the same care as someone paying far less. And no, it's not because they're uninsured. It's not because they're sick. It's definitely not because they need better coverage. The truth is far more frustrating. Health insurance companies count on you not knowing how to lower costs without reducing coverage. They profit from confusion, fear, and the assumption that cheaper always means worse. In this video, I'm going to show you exactly how to flip the system legally, safely, and without sacrificing a single benefit. Every year, Americans brace themselves for the same painful moment. Open enrollment. Premiums go up. Deductibles get higher. And suddenly, you're staring at a screen wondering which option hurts the least. Most people assume there are only two choices. Pay more to stay protected, or pay less and risk everything. But that assumption is exactly what keeps healthcare so expensive. Here's the reality most insurance companies don't want you to understand. Lowering your health insurance costs does not mean reducing your coverage. It means understanding how the system is structured and using that structure to your advantage. Health insurance pricing isn't based on how much care you need. It's based on how likely you are to overpay. Insurance companies know that people are afraid of medical bills. They know we fear emergencies, surprise diagnoses, and what-if scenarios. So they design plans that feel safe but quietly drain your wallet through unnecessary access, unused benefits, and poorly chosen plan features. This is why two coworkers with the same job, same salary, and same health status can end up paying wildly different amounts for healthcare sometimes. A difference of $5,000 or more per year. And the craziest part? Both of them might have identical coverage on paper. In this video, we are breaking down the 7 most effective ways to lower your health insurance costs without cutting coverage. These aren't loopholes or shady tricks. They're strategies that work for employees on employer-sponsored plans. Self-employed workers and freelancers families buying insurance on the ACA Marketplace. Anyone frustrated by rising premiums and confusing options. We'll cover how to identify where you're overpaying, how to use plan design to your advantage, and how to stop wasting money on coverage you don't actually use all while keeping the protection you need. By the end of this video, you'll know how to pay less every month without downgrading your plan, reduce out-of-pocket costs without losing benefits. Use insurance rules the same way companies do make smarter decisions during open enrollment. If you've ever felt stuck like healthcare costs just keep rising no matter what you do, this video will change how you look at health insurance forever. Let's get into it. Most Americans think their healthcare is expensive because they go to the doctor too much. But here's the truth. The biggest cost isn't care, it's access. You're paying every month for the possibility of using healthcare, not the care itself. That monthly premium is essentially a membership fee. And most people overpay for access they rarely use. Think about it. How many doctor visits do you actually have in a year? For most Americans, it's fewer than 5. Yet people routinely choose plans designed for worst-case scenarios, top-tier networks. Nationwide access, out-of-network coverage, just in case. Insurance companies love this mindset because fear-based choices are expensive choices. Here's how overpaying usually happens. You choose a plan with maximum flexibility. You pay higher premiums every month. You rarely use the extra benefits. You still pay copays and deductibles anyway. That's thousands of dollars spent before you even step into a doctor's office. Lowering your costs without reducing coverage starts with a mindset shift. Stop paying for insurance based on fear. Start paying based on reality. If you mostly use one primary care doctor, one pharmacy, 1 or 2 specialists, then you don't need nationwide access or out-of-network flexibility. The goal isn't cheap insurance. The goal is efficient insurance coverage that matches your real usage. Once you stop over-insuring for unlikely scenarios, you unlock the first and biggest opportunity to save money without losing protection. One of the fastest ways to lower health insurance costs without touching coverage is to optimize your provider network. Here's what most people don't realize. Insurance plans aren't priced by benefits alone. They're priced by network size. The larger the network, the more expensive the plan. Many Americans choose plans with massive networks just to be safe, even though they only use local doctors. That extra network access costs real money every single month. Here's a simple exercise. List your current doctors. List your preferred hospital. List your pharmacy. Now ask one question. Are all of them in-network on a smaller plan? If the answer is yes, congratulations, you've just found a way to save money without losing anything. Narrow network plans often offer lower premiums, lower deductibles, lower out-of-pocket maximums, same quality of care, and no. Narrow networks don't mean bad doctors. They often include the same hospitals and providers, just without the excess. The key is checking before you choose, not after. Insurance companies count on people skipping this step. They assume you won't verify doctors. They assume you'll panic and choose the biggest network available. But when you intentionally choose a network that fits your life, not your fears, you keep the same doctors, the same care, and significantly lower costs. This one decision alone can save hundreds or thousands per year. Most people think a lower deductible automatically means lower costs. That assumption costs Americans billions every year. Here's the truth. A higher deductible does not mean higher total spending. In many cases, it means the opposite. Plans with higher deductibles usually have much lower monthly premiums, similar out-of-pocket maximums. Identical coverage after the deductible. The question isn't, can I afford the deductible? The question is, will I actually reach it? If you typically spend $500, $1,500 per year on healthcare, but your low deductible plan costs $200 more per month, you're overpaying by design. Let's say, low deductible plan costs $2,400 more per year in premiums. High deductible plan saves you that $2,400, you only spend $1,200 in care. You just saved $1,200 without losing coverage. Out-of-pocket maximums protect you in worst-case scenarios. That's the safety net people forget. Once you hit that number, insurance pays 100%. Smart strategy: accept a higher deductible, keep the same out-of-pocket, max lower monthly premiums. Use savings for actual care. This isn't risk, it's math. When you understand how deductibles work, you stop paying for peace of mind that you already have. Here's a painful truth. You're already paying for benefits you're not using. Most health plans include a massive list of zero-cost services. Preventive screenings, annual physicals, vaccines, mental health check-ins, telehealth visits, wellness programs. These aren't bonuses. They're included in your premium. Insurance companies profit when you forget they exist. For example, many labs and screenings are 100% covered when coded as preventive. Telehealth visits often cost $0, $10. Mental health services are heavily subsidized, but people default to urgent care, ER visits, or in-person appointments that cost far more. Using free benefits doesn't reduce coverage, it maximizes it. Another hidden area: care timing. Preventive care now often avoids expensive treatment, later keeping you from hitting deductibles at all. Insurance isn't just for emergencies. It's a toolkit, and most people only use the hammer. The more you use what's already included, the less you pay out of pocket over time. Many Americans assume employer insurance is automatically the best deal. That's no longer true. Marketplace plans often offer comparable coverage, better plan variety, income-based subsidies, lower family costs. Some employer plans are expensive simply because employers shift costs to employees. Here's the smart move. Compare total annual cost, not just premiums. That includes premiums, deductibles, employer contributions, prescription costs, family coverage, pricing. For some households, Marketplace plans cost thousands less with identical benefits. Especially for families, single-income households, freelancers. People with kids. Lowering costs doesn't mean loyalty, it means comparison. Prescription drugs are one of the biggest hidden drains on healthcare spending. Same medication, same dosage, wildly different prices. Insurance formularies are complex on purpose. But here's how to save. Ask about generics, compare pharmacy prices, use mail-order options. Check cash pricing versus insurance. Sometimes, not using insurance is cheaper. Also, many plans cover 90-day supplies at a discount, yet few people use them. Prescription optimization alone can cut hundreds per year without touching coverage. Insurance should never be set it and forget it. Every year, plans change. Networks shrink, drug tiers, move costs, rise, yet people stay loyal and pay the price. Once a year, do this. Review your actual usage, check doctor networks, compare total costs, adjust plan design. This 15-minute habit can save more than any financial hack. The system rewards people who pay attention. Lowering your health insurance costs doesn't require cutting coverage. It requires understanding how the system works and using it intentionally. You don't need worse care. You don't need risky plans. You just need smarter choices. This video helped you see health insurance differently. Do me a favor, subscribe for more clear, no-fluff healthcare breakdowns. Like this video so more people stop overpaying. Comment below with your questions, I read and reply to everyone. Your money matters. Your health matters. And now you're in control.